I want to just bring everybody's attention to items 6R, 6S, and 6T on the consent calendar. And I do want to thank the Joint Committees, Education and Culture, as well as HHS, for a very productive session to talk about this particular proposal, which I have shared with all my colleagues. This is a proposal to begin an interim phase of expanding wellness centers to all high schools. This obviously, it's something that this entire council has considered to be a priority for many years. However, the last 2 years, as we all have discussed, have come to absolutely turn our world upside down, and we have seen the devastating effect that this pandemic has had on the emotional and mental health of our young people, of our students in MCPS, as well as, of course, the faculty and parents. And unfortunately, we have all been dismayed at reports of suicides among our young people. There was a shooting in my district at Magruder High School, something that we had never experienced in Montgomery County. And time again, when we hear from those who work with our youth, those teachers, parents, what we hear time and time again is that the sustained stress, the social isolation, the grief around loss that many of our young people have experienced during the pandemic has exacerbated quite a lot of issues and put so much pressure on our students. And so this particular proposal, it's not the complete wellness center type model that we have in some high schools, Wheaton High School being one of them, but it's an interim effort to give the school system as well as HHS the opportunity to start building up the capacity, but more than anything is to provide a safe space for our students to be able to go to and be heard, be seen, be comforted, really truly not have to jump through so many hoops to try to access that type of support, but that it is embedded within the school. And so I first want to thank Dr. McKnight, the Board of Education, for their absolute collaboration. I think today we celebrate the spirit of collaboration. They have been amazing. And you see here that one of the appropriations that is in the consent calendar came from MCPS, and this is for them to augment the procurement of portables for this effort. You also will see an appropriation for HHS for operating dollars, but also to be able to retrofit some of the internal spaces to begin this work. The Department of Health and Human Services, also I want to thank Dr. Kroll and all of their amazing staff, Ms. Dira Trent-Vance, who has worked so hard on these issues. I also want to thank the leadership of the PTA. Their mental health subcommittee has been amazing. We have had so many conversations also with stakeholders, and we have heard from our young people, especially during this particular time. And lastly, I will say that the leadership of Councilmember Rice, chair of the Education and Culture Committee, and Council President Albornoz is also important to recognize, because this has been an ongoing, I think, all hands on deck effort to respond to many of these particular issues. Councilmember Glass in the past has also been, constantly reminding us of the need of social workers, for example, in the schools. And so this is a shared desire. And again, this particular ambitious proposal is one of those that I often say, in times of crises, there is nothing more important than bold response and immediate response. And we know that we're still in a time of crises. And so I thank everyone. I know consent calendar, we usually don't talk so much, but this $8 million special appropriation that the joint committees have already agreed to support is the beginning of this effort. There is also, of course, a proposal for the long-term efforts that we're going to need to undertake to really strengthen these wellness centers, et cetera. But it's important to start now. lastly, shout out to the Street Outreach Network, which I'm now rebranding as School Outreach Networks. But, that kind of youth workers embedded in the schools is so important. Oftentimes, and I have heard this directly from our young people, they may not feel comfortable even approaching a counselor or a social worker. But you know what? They do feel comfortable approaching a youth worker that they feel they can connect with on that level. And that is so important in this particular moment. So thank everyone. I think that this is something that will go a long way, but it is not like we're done. It's just the beginning, and it's a way to respond again to something that we consider to be a crisis moment within our young people in our schools. And hopefully we'll be able to do something for our middle schools, because we are also hearing a lot of issues affecting our middle schools. So hopefully we can work together on that as well.